At the end of the day, most patients and most people in general really want to be heard. They want us to understand what's most important to them. I may have the same patient on the surface, same type of tumor, same symptoms, but the way that they want to approach their care may be completely different. And it's our job to understand that and to help them navigate the course of the illness in a way that makes sense to them and that is compatible with their life goals. I'm Stephen Bagley. I'm an attending Neuro-Oncologist and Section Chief of Neuro-Oncology within the Division of Hematology Oncology here at Penn Medicine. I see patients with any type of primary brain tumor, but the vast majority of my patients have glioblastoma. And that's because it is the most common primary brain cancer in adult patients. But it's also because that's where my research lies. Most of my clinical trials are being developed for glioblastoma, so most of the patients who end up in my clinic have that diagnosis as well. Part of what we do in that first visit is to try to make sense of it, helping them understand what we're dealing with, and that this is something we do all the time, and that we have a very good and evidence-based treatment plan to get them through it. I think that the best part of my job is watching something that my colleagues and I have worked on in the laboratory and through many hours of discussions and iterations of protocols to actually watching that being administered to one of my patients who needs it. And in the cases where we actually see that provide therapeutic benefit, it's even better. So I absolutely love the idea that all the research going around me at Penn every single day, I can be doing that in the morning, and then in the afternoon, watching it actually go into a patient's body and give them hope for their tumor. I think that there are very few professions where you have that sort of immediate impact, and I absolutely love that.